say that out of all the specialties in medicine, cardiology has contributed 7 of these 10 years. And when we went into more details, we found that the lifestyle modification of healthy diet, exercise, tobacco cessation plays a major role. And then the good drugs like antiplatelets, beta blocker, ROS blocker, and statins have also played a very important role. And altogether, 90% has been basically because of control of the risk factors. So all the lifestyle and drugs have resulted in control of the risk factor for cardiovascular disease. Only 10% lifespan increase has been contributed by cabbage and DTCA in a setting of acute coronary syndrome. So going through the further details about the various risk factors, all of you know about that. We're discussing more details. The lipid is most important risk factor, and among the lipid disorders, the LDL plays a pivotal role in pathogenesis of atherosclerosis. And we have learned now that the LDL comes from the diet only in 15-20% of patients, but percent cases, but around 75 to 80% is synthesized in the liver, and which is largely genetically determined. The other risk factor, all of you know, they are diabetes, hypertension, smoking, central obesity, and bad lifestyle. So this slide is a simplified slide just to show you how the atherogenesis starts when there is an endothelial dysfunction sets in because of various risk factors like diabetes, blood pressure, the smoking, stress, bad lifestyle. Everything causes endothelial dysfunction, small holes in the endothelium, and ultimately the LDL particles, they enter and start forming the foam cells or atheromatous plaques, and gradually the blockage of the artery comes up. And HDL cholesterol, what it causes a reversal of the atherosclerosis by removing the LDL from the atheromatous plaque back to the circulation. This, all of you are aware of that. Now, as I rightly said, that the around 80 to 85% is synthesized in the liver, and 15 to 20% come from the diet. And among the diet which contains cholesterol is basically animal products. They are basically milk, egg, and meats. They are the sources because animals have liver synthesize LDL. So anything comes from animal kingdom will have LDL cholesterol. Whereas plant products, since they do not have any liver, they will be free from cholesterol, which includes everything like fruits, vegetables, cereals, pulses, all nuts, including cashew nuts, soya bean. Every product from plant kingdom are free from cholesterol. Now, coming to the very common questions, and which has been recently been updated by the American Heart Association dietary guidelines, and you must have read there, and people are mistaking this information that cholesterol is not important. No, they did not say like that. They say cholesterol from the diet has been removed as important offending agent because dietary cholesterol's absorption is very complex, and I mean it is genetically determined. Diabetic probably will have more absorption of cholesterol compared to non-diabetic. So it is very complex. So they say since it is only 15 to 20%, unnecessarily restricting cholesterol too much from the diet may not be a good idea. So what we have learned then that it is not it is the sugar probably which is causing more dangerous atherosclerosis compared to the saturated fat. If you take saturated fat, I'm repeating it, in a modest quantity, mild to modest quantity, not in large quantity, like the even butter or non-vegetable saturated fat, then we have increase in LDL cholesterol, which is large size, but at the same time, HDL cholesterol also goes up. So the ratio between LDL and HDL remains same. Whereas if you, on the other hand, take a lot of carbohydrate food, particularly sweets, so the sweetened beverages which we take a lot, they are going to increase triglyceride. And as the triglyceride goes up, the HDL will come down. But the LDL particles are not touched because there is no LDL in this type of food particles. So, but the size of the LDL becomes smaller. And the ratio between LDL and HDL changes because the HDL is low. And because of that, combination of the ratio going up and the LDL size becomes smaller, then it causes increase in atherosclerosis. So it is much more common than compared to the saturated fat. But remember, another important thing which I want to repeat it again and again, that a patient who is suffering from cardiovascular disease or who is a diabetic or who has already high cholesterol in the blood, like familial hypercholesterolaemia or genetic reason for that, then they should restrict their saturated fat intake to milder form. But rest of the public, those who do not have this, mild to modest intake of saturated fat probably may not give you so much of harm. because it is genetically determined liver synthesis of LDL cholesterol. We're sure sugar.
Question. It's from Dr. Sanjeev Mishra Puri. He is asking, what is the treatment for type 1 hyperlipidemia?
I think what you can make out that is a chylomicron type of thing which is very common. It is very difficult. It's a genetic disorder where there is a primary hyperlipidemia which comes up at very, very high level of high triglyceride levels, going up to 1,000 to 2,000 or 4,000 milligram of triglyceride levels. A genetic defect which we have seen. And it's a very difficult clinical situation because here it is the chylomicrons which are very high, not the VLDL cholesterol. And for them, the best will be, of course, the lifestyle modification, as I told earlier, like we have to stop smoking, stop alcohol, reduce your weight, reduce your sweets and carbohydrate foods, and start walking, exercising. These are all the method lifestyle modification works, no doubt. But they are only able to reduce triglyceride 3 to 400 milligrams. You add phenofibrate to this patient, and again there is a limitation of once a tablet per day is allowed. And after that, we generally add these days the fish oil, the true drug EPA of the which used to have available earlier was Omacor. We used to give 2 to 4 gram per day. The other on-the-counter fish oil capsule which are available in the country are not effective. They have a lot of they are not very purified and very bad taste. Omacor had a tasteless fish oil capsule. They were effective in reducing triglyceride. But I've seen, in spite of that, that actually triglyceride levels goes and chylomicron levels are very high in this population, and they are on great risk of pancreatitis. Sometimes some of these patients get recurrent pancreatitis also. So it becomes a really problem and challenge situation for managing this condition. And now a new drug, which I'm forgetting the name, volanesorsen injections are being developed now. A group of drug which is I am not is just I think at the moment phase 2 or phase 3 stage of the drug, which has shown that it reduces the that familial hypercholestomicron syndrome, what we say FHS condition, significantly reduces triglyceride level by thousands milligram. This drug is under development at the moment. And the other drug which we sometimes use is lipaglyn in our country, which is available, syroglitazone, is again a drug which is good to reduce triglyceride level, but is only been released for diabetic population. Non-diabetic population, it is not good. For diabetic population, I also have observed that if your diabetes is uncontrolled, that your HbA1c is more than 10, then even just controlling your diabetes with good anti-diabetic drugs, bringing it HbA1c to around 7, 7.5, also reduces triglyceride by 2 to 300 milligram, which is very effective in that. So I fully agree with Dr. Mishra that this is the limitation of this disease entity, although it is rare, 1 in 1 million only, but this is condition which is difficult to treat at the moment.